What's up, everybody? I'm Dr. E from Baker Health.
And I'm Dr. Brian Kokulak from Edge Pro Physical Therapy.
We're very, very lucky to have Brian, who I've known for quite a while, who's a physical therapist by trade and does take care of a lot of our members. And thanks for having us here in your
Thanks for
facility.
coming. Thank you.
So wanted to just ask you and chop it up with a couple of things. Um, Physical therapy is one of the things that there's a ton of referrals for that happen all the time from once a baby's born, for whether they have shoulder dystocia or something like that, torticollis, all the way to the tail end of years where there's balance issues. Um, Tell us a little bit about what your focus is and how you got into it.
Yeah. My background, I've been a PT for 10 years and I've worked within sports and orthopedics for that entirety. I've gotten board certified in orthopedics. I still teach. I'm an adjunct professor in a PT program. So I just love teaching. I love educating as well. But we've been teamed up with this gym here in Paramus called TNT Training. And I've worked with that and been teamed up with them for 9 of those years. So in that process, we've gotten very involved with team training and some small group and individual training, but working symbiotically to help some of the members that have, overuse injuries or sometimes acute injuries and some serious surgeries that need help, but also working with the teams and working with the gym and their coaches and the trainers to basically keep everyone healthy and keep them in training so they can stay on track and get their goals.
Mhm. And what's your focus? Your focus is it mostly athletes in high school, college? I know you deal with a lot of the pro MMA fighters and things like that, but is that basically what your target audience is?
Yeah, our niche and who we specialize working best with is an athletic population, youth athletes, that teenager to high school age. We got a lot of collegiate athletes as well that return home on winter breaks, summer breaks that need rehab, and then moving into that professional crowd of NFL and UFC athletes, and then all the way up to some active adults, CrossFit athletes, avid runners and marathoners, and those are the people that turn to us for our specialty and how we help them best.
Okay, so I'm going to ask a couple of questions based on my bias and my experience in working with yourself and other physical therapists. There's got to be some secret sauce that you have when somebody has an injury, in particular, one of the most common injuries, which is an ACL or a meniscus. And all these athletes, obviously, those can be career ending. There's a couple of guys like Tony Ferguson in the UFC, to this day is one of the most incredible stories that I've seen, where he had an ACL reconstruction and was back in the octagon within several months. Versus when you see some folks that have an ACL injury in the NBA and they're out for 2 years. You, to me, are in the first camp that I've seen a lot of the fighters that I take care of, that you take care of, and after their surgery, with your physical therapy, they come back at least as strong, if not stronger. What is it that you do for that?
I think it's just a lot of the experience that we have in working with that specific injury. I That's one of my favorite things to treat is ACL rehab in general. It's absolutely stinks that 25% of ACL injuries have a re-tear within 2 years.
Mhm.
That number is far too high. So we absolutely need to get better at just returning athletes to to their sport. And I think a lot of it comes down to just a lot of experience using the proper research and the evidence based research in all the studies that are put out there, and applying that to them, utilizing like early on for ACL, NMES, and that Russian stim, getting blood flow restriction on pretty much as quick as possible, which helps boost a lot of strength throughout their rehab process. Moving into, getting them back to running, following the right protocols. We are moving away from a lot more time-based protocols where you hit 12 weeks, you can go run.
Mhm.
It's now, okay, you hit 12 weeks, physiologically that graft and that bone site are well healed, but do you have 70% strength? Do you have
Mhm.
no swelling, full range of motion, and a lot of these other pre factors that can say you are ready to run, and then you're going to run with success. Put you on a running program, We move into jumping after that, and then from there it's just more sport specificity. Someone's, specific position, maybe in football, or if they're like that wrestler MMA, kind of guiding them back into what they can start to do by getting back on the mat, non-contact wise, and then moving into contact. But then all the way, to that 9 month, that sweet spot where the re-injury numbers go far down, and just proper testing throughout, making sure their strength is up to speed. And my goal, my personal mantra is like, leave here a better athlete. And it's cool. One of the UFC athletes, we were recently rehabbing for his ACL. I think it was right before he was even starting to run. So we're like 2-3 months post-op, and he's like, you guys are finding things that I didn't even know like were weaknesses in me. So again, finding those little things and helping him just move better, move more efficiently, which is going to help him just become more powerful, move around the octagon a lot more smoother and quicker. And he went back and had a second round knockout his first return back into the octagon, and then he's got another fight coming up in June.
Good, good. Yeah, I think that's one story of many that I've seen with you, Brian. What is your thoughts on, from the traditional physical therapy from like 25, 30 years ago, basic things like after an AC, regardless of the injury, but any lower extremity injury, and things like squats where you should not have your knees ever go over your toes. And now there's a lot of data and a lot of people that have made their career based on flipping that theory on its head. And still, like if you go to certain colleges and pro athletes where they have their strength and conditioning training, the modalities that they use, like the sleds, going forward with the sleds, pulling the sled back, which did not exist before, are now part of the norm. How did that evolve? And number two, do you believe in that? Do you think that that's really the right route? And as a professor, is that now part of the normal nomenclature in the education for the
Yeah,
PTs?
science has progressed. We've gotten more creative with exercises. But you can get real fancy with a lot of the fancier exercises you might see out there on social media and stuff. But if you do the basics well, you're gonna get someone better a lot faster, a lot quicker. You don't need some of the fancy glamour stuff. So going back to some of like the knees over toes, it's just identifying that right movement pattern. So if I get someone who's coming in with an anterior knee pain, do we, to a point, is it just, we got to identify, is it like a flexibility issue? Is it a hip or core weakness issue, an ankle mobility issue, a training error? Or is it a youth athlete that's just going through a growth spurt and having some Oscar Schlotter's kind of thing? You got to differentially diagnose all those things. So sometimes we want to deload and improve movement patterns by maybe facilitate more like, posterior chain loading. But the later stages of that rehab, no, we definitely got to come back to that and help load that anterior knee and load patellar tendon. So those basketball players and triple jumpers that load those areas very like hard, have that, have that load capacity that they're not going to have that that injury come back.
Yeah. No, that's super helpful. What about your theories on when somebody is recovering after an injury and you start to identify weaknesses like you talked about, flexibility, I'm sure, being at the top of the list. Now with all the new research with TRT, testosterone replacement therapy, peptides, all of those, do you recommend and incorporate that as part of the PT during the journey to get to the 9 month where you're that's sort of where it's going to be? Or do you prefer that they wait until all the PT's done and then go ahead and start the muscle mass building and things with the exogenous use of
Gotcha.
it?
Get asked that question a lot about some of the new supplements and peptides that have come out to try to enhance that performance. I always kind of default for, is that legal in your sport? Like the NFL can't do some of that stuff. UFC tests for some of that stuff. So you can't, I got to advise them on that and kind of gear them, NCAA, is this stuff even, you can't even do it. So it's usually a post later performance. I don't see enough evidence currently, it might change, but about incorporating a lot of that stuff just yet. It's really just about doing the basics, doing them well, proper loading. And you're going to get that athlete back. I always touch on nutrition, like ACL rehab. Like one of my first conversations we have is, when you're leaving after that first day, is keep your nutrition the same. Your calories might have to come down a little bit because what you're expending will go down because you're not walking as much. Your total steps a day and stuff are going down. But you need that protein content still high because we got to get this muscle, this muscle, this muscle all getting stimulated to get back. So we need to fuel. We need to feed it.
And when the protein content high, do you stick to the 1 gram per pound of body weight of protein a day in recovery, or do you increase that post-injury?
Increased. Again, really maintain their current diet. We get some youth athletes that have no idea, no experience, or even parents that don't know what they should even be hitting. So that's where I can make the referral to more of a sports nutritionist,
Right.
and get them full guidance. But if it's just in here, I can give some, incorporation of 1.2 to 1.5, depending on male, female, and kind of just keep them on the right track so that area is getting fueled.
Right. And to the point about the supplements, when I get asked, or a nutritionist that we work with gets asked about the supplements question, it's interesting when I put one thing in perspective to them and I tell them, when somebody weighs in before a fight, they cannot have even an IV above 250 cc's of saline. The fact that that could be told by the blood work, everything else will definitely be realized through that. And so, yeah, as the governing bodies change their recommendations on what is or is not preferred, it's a very, very hard question to answer. And depending on the sport, it's a very, very novel concept. What is your experience with stem cells post recovery? And this one, not really just unique to ACL. You see a lot of stuff that's out there now where a lot of the elite athletes, they'll go ahead and they'll get like full body stem cells, like an IV, which strengthens not just an injury, like a peptide or the rehabilitation that you'll do, but the full IV for it, which strengthens literally your skeleton and things like that. Do you find the stem cells to be very, very beneficial, or is it still not there in your eyes?
Subjectively, what I'm hearing from a few of the athletes that I know that do it routinely is their turnaround when they tweak something is actually even a lot faster.
Right.
Just had an athlete who I worked with for many, many years. He moved away to Tampa, and he called me. He's like, I got an injury outside of his knee, LCL injury. We kind of diagnosed it over the telehealth call. And 2 days later, he's like, I feel 80% better. And there's still even like a palpable like shift and clunk in his, and he attributed it to the stem cell treatment he did 2 days prior to that should be circulating throughout the body. So it should be expediting that healing phase. And again, making those tissues a little bit more resilient.
No, that's exactly what we see already out there. Now, what's like the standard of how many times after an injury, and I'm sure they vary, whether it's Achilles tendon rupture, ACL, whatever it is, epicondylitis, how many days a week? Because we get this a lot too. A lot of the elite athletes, they train day and night. So there's no such thing to them as I'm kind of tired. I see with those guys that you kind of have to pull them back and they'll literally overtrain and things like that. So in the rehab part of an injury, how many days a week do you find it to be optimal to get them back quickly without letting their fire inside keep wanting to work and then actually aggravate it more?
Yeah, pending injury, if we want to talk ACL, I mean, it's usually that 3 to 4 times a week that someone's in here. And really, I'd say, let me take over your lower body lifting. I got your lowers covered. Sometimes some NFL athletes will come in and their prescription says 5 times a week. It's a workers' comp case. So it's literally their job to get back on the field. So we're working with them 5 days a week. And I think that's some of the contributing factor why they get back so quick is we do have that availability to work with them a little bit more frequently. But I say just turn over your lowers to me. And then in the meantime, they're working with their strength and conditioning coach and team lifts, and they're doing uppers. They're still doing core after a couple weeks of surgery. They're starting that back up as well.
Good. Could you tell me a little bit before, when somebody's going to go ahead and start, now this question is independent of recovery after an injury. But yourself as a tier 1 PT guy, what is stretching routine for the athletes. Could you describe a little bit between like static and dynamic stretching, when they should be done, how long before whether it's a game or a match or what have you?
Yeah. Pre-game warm up. Always, I can kind of break it down into like 4 things where you can do some soft tissue release. So you got your foam rolling or using a lacrosse ball to just kind of dig at some spots, get a little, loosen some things up, decrease the tone, get more blood flow in the area. Going through your stretching and mobility work. If you have tighter hips, some joint mobilizations that we can kind of teach you are very helpful. The stretching, and then going into like some activation. So if you've been having deal with some knee issues, and all right, here's some extra activation exercises for your glutes to do pre-training. And then like that 4th step is more of that movement plan. So practice a few lunges, practice some squats or jump squats, something like that to get the body more prepped and primed. Pre-activity, pre-training, your dynamic stretching is where you want to be at. Moves of 5 to 10 yards at a sequence. You're starting to get the heart rate elevated. You're increasing circulation throughout the body, and you're more preparing tissue for impact, whether that be running, bounding, striking the soccer ball, or wrestling someone to the ground in MMA.
Yep. And what about after it's over?
Post-training, that's when your static stretching can come in. Cool downs are important. Everyone always skips them. It's important to get the cool down to get that venous blood flow return, and help like promote just overall like circulation, lower your blood pressure, return your heart rate to a more of a static versus just that hard stop when you finish a game. So get your cool down run in, and then that's where your static stretching comes in. Your 30-second intervals. And if you're dealing with, let's say, an Achilles tendonitis issue, you definitely need to be doing extra static stretching post, because once you stop that activity is usually when that tendonitis pain starts creeping back in.
Right.
So that's just being more diligent with it then.
That's great. Your thoughts in your world about acupuncture and chiropractor?
There's great people from both professions. We combine them in clinic. We have chiropractors within this clinic that I'm in here, and our other locations actually also in Paramus. We combine them, so we do look at a holistic approach where someone can get access to the whole gamut. Where we do some joint correctives, maybe a chiro specializes in. PT can come in and we focus on the soft tissue, stretching, loading, and prescriptive exercises. And then maybe that post-training, you got that acupuncture to kind of calm the nervous system. I personally am dry needling certified, so I'll incorporate dry needling into a lot of my treatment sessions as well.
And what about the new modality of cupping?
Cupping, we've been using a long time. Very popular. I'm a bigger fan of dry needling though, much more intentful.
So what's the reasoning for that? Because that's one of the things that's newer for the entire wellness arena. Could you explain a little bit about the difference and why you think that's better? Because a lot of the questions that'll come up to some physical therapists, some people that are specialized in one modality, usually lean towards that. You do all of that and you see the results. Why do you think that's better?
Yeah,
and how does it work for those who don't understand?
Sure, patient specific. Some people don't deal with needles. They're not appropriate for it. So we're going to turn to the cupping for that. Sometimes if it's more of a superficial injury, cupping should do the job, but you got to combine it with the great soft tissue work and, active release kind of work and massage work and, joint mobilization and stretching. Cupping alone is not going to do enough to make a mechanical change. But now when we're talking like hamstrings and we need to get to that deeper tissue, cupping's only going to get so far, but that needle can penetrate pretty far down. Additionally, adding some electric stim to the dry needling helps release a lot of hormones, which again reduces pain. It actually helps facilitate circulation. It maintains activation of the muscle, especially when there's trauma and there's an injury. That muscles kind of want to shut down. So the stim will help kind of keep it turned on. So function stays higher, pain stays down, and just feel better.
And so like the basic fundamental premise behind the cupping is literally, for those who don't know, it's a cup and you perform suction and you put several of them on the back, suction up all the tissue and leave it there for a while so that all the blood flow will get there. It can reduce inflammation, help recovery, all the above. Could you explain a little bit about the dry needling? Because nobody really sees the scars and the dry needles. Everybody sees the cupping when somebody's on the beach or they're watching a game. How does exactly like the procedure work for the dry needle?
Yeah, so back to the cupping. I mean, you're gonna work on more of the superficial
Mhm.
layers. You're gonna get the skin, the fascia, some of that connective tissue, which will manipulate, kind of pull on the muscle. That negative pressure pulls blood flow to the area. The needling is basically a direct intramuscular or into the tendon or ligament or whatever we're needling or around a nerve, and that direct like penetration of the needle actually stimulates an inflammatory response, so it's going to trigger your body to basically turn over healing.
Mhm.
It's going to bring a lot of cellular healing to the area, and like I said before, like a lot of like hormone release, and just like opioid release that are your feel good. So it'll kind of numb out the pain and dull down the pain.
I gotta come and try that one.
Oh, you're on.
So what do you think, Brian? What do you think is the something about your world in PT for any athlete that is watching, something that they should incorporate in their daily routine to number one, prevent the injuries, especially for those athletes that they may not be going to the UFC, they may not be going to the NBA, but they do stay very, very active. And I asked this question to a lot of folks like yourself. Some of them is their main thing is diet. Some of them is stretching. Definitely all across. But what do you think is the number one that people are really missing?
Overall, my big answer would be just consistency.
Mm,
You know, one thing a day of something specific is not gonna prevent anything or stop anything. The next thing I'd put right underneath that is strength training.
mm,
Strength training is probably one of the biggest research-based, you know, things out there where that are gonna help with injury prevention.
mm,
Strength training will help increase your flexibility as well, especially like eccentric loading of
mm,
specific muscles can help increase your flexibility. Very similar to static stretching.
mhm.
So I would go with those two answers.
That's great. And tell us something a little bit about your group. Do you have one location? Do you have several locations?
Yeah. So our Edge Pro location, like I said, we're located in Paramus inside TNT Training. We do have another headquarters location. It's located on Route 4 in Paramus, and then a Edgewell location, which is located in Fort Lee inside of a Retro Fitness.
Awesome. Well, wanted to thank you very, very much. The work you do with all the athletes that I've seen are second to none. So wanted to first congratulate you and
Appreciate it.
thank you for having us in your home.
Appreciate it. Thank you.